Now, your forecast first, sponsored by Matex Heating, Cooling, and Plumbing.
Temperatures tonight are really cold once again. We're heading back down below freezing. 33 in Champaign, 36 in Effingham. Freeze warning in effect as we head below that freezing mark. Once again, we've done this several nights here lately, and we're going to do it again tomorrow morning. But the thing that you're going to watch more than anything, that's going to be the potential for snow that is out here in Iowa right now, and it's going to head right across some parts of central Illinois to make that morning commute for the 15% of you that have to still go into work. May look like that if you've got to drive, so look out. We'll talk more about how much snow we can see when we come back. WCIA 3 News starts right now.
Now from WCIA 3 News.
All of a sudden, there's a pandemic that is kind of tailored specifically for respiratory.
And these students are prepared to help fight it, how they have a specific skill set to assist patients.
It was a very heartbreaking decision.
They've taken in wild animals in need of help for decades, but one center is stopping for now. Some activities are hard to do if you have to stay at home, but not this one. Why it's becoming popular.
You're watching your local news leader. This is WCIA 3 News at 10.
We start with breaking news. One person was airlifted to the hospital after a crash tonight. This crash happened at the intersection of County Road 200 East and 490 North, east of Ivesdale in Champaign County. WCIA 3's Emily Braun is live at the scene now. So, Emily, what else have you been able to find out?
Well, Jessica, right now, there's only a few crews left on scene. We've got a couple of police cars and the tow truck that's loading what's left of the vehicle onto it to be taken away. Once they do that, the scene will be clear. Sedoras officials weren't able to release much, but what they could tell me was that there was a man riding a motorcycle when he crashed. He was in very serious condition and was airlifted to the hospital. So, again, a very busy scene that lasted probably about a little over an hour and is still going on now. It should be cleared pretty soon, again, once that tow truck is able to get out of here. But at this time, that is the information that officials were able to tell us. So for updates, please stay with us on air and online. We will be sure to keep you informed once we receive more information about the victim and, of course, once we find out more about his condition. For now, we're live in Sedoras. Emily Braun, WCIA 3, your local news leader.
All right, Emily, if you get any more details, let us know. Thank you. As we first told you on the WCIA 3 News app, crews are investigating the cause of a fire in Decatur. This happened at Hilltop Drive and Lost Bridge Road. One of the homeowners says she had just pulled her car into the garage tonight when she smelled something burning. Then she heard a boom and the shed next to the building burst into flames.
I ran in the house and told my husband there was a fire, and then called 911, and then I had to get my car out of the garage and just trying to move out the vehicles. And
the shed and a nearby camper were destroyed, and the side of the garage was also damaged. No one was hurt. The state's Department of Public Health released new COVID-19 numbers today. There are another 1,200 confirmed cases and 74 deaths in Illinois. That brings the state's total number of cases to more than 23,000. 868 people have died. In central Illinois, another person died in Christian County. That county's death toll is 4, and 24 people have tested positive in that area. In Macon County, the number of cases is up to 43. 3 people have died, and more than half of those 43 cases are linked to Fairhaven's senior living facility in Decatur. The healthcare workers dealing most directly with COVID-19 patients aren't just doctors and nurses. They're also respiratory care therapists trained specifically for helping patients breathe. WCIA 3's Emily Braun explains how Champaign's Parkland College is helping train the next generation of respiratory care workers for work on the front lines.
And how have you felt knowing that you're a part of a program that is the exact niche that our communities need most right now?
It's a little surreal right now. Being in the last, few weeks of the program, and all of a sudden there's a pandemic that is kind of tailored specifically for respiratory.
It was long before the COVID-19 outbreak. Parkland respiratory care student Megan Metcalf knew this was her niche.
My mom has asthma. My brother's chronic bronchitis. He was on a ventilator when he was a baby, so I kind of already knew about the program. about respiratory in general.
She'll graduate in May, hoping to immediately join the ranks of program alums like Brianne Condi.
We definitely need registered respiratory therapists in Central Illinois.
She's in the hospital rooms with patients, helping them fight back against COVID-19. One of the biggest lessons Condi took from Parkland's program to her job at Decatur Memorial Hospital is the importance of patient advocacy.
You know, somehow there is a lapse in that treatment plan, that the inpatient respiratory therapist can be there to help hold those patients' hands, whether it be as simple as a nebulizer to someone being on a mechanical ventilator.
The respiratory care program has been around since the 70s, but now during this pandemic, program director Midge Same wants people to see and know this. Respiratory care workers are critical. Their mission? Simple. Rest easy and breathe easy.
We aren't as visible at the bedside, often confused with, are you my doctor, are you my nurse? No, I am your respiratory therapist, and I'm here to take care of all of the breathing issues.
In Champaign, Emily Braun, WCIA 3, your local news leader.
The program director says Parkland is still looking to fill a few slots for their fall class of respiratory care students. If you know someone who may be interested in applying, we have a link on WCIA.com. COVID-19 has put a lot of people out of work, but it also made work a lot harder for many people still on the job, especially those who work inside of other people's houses. WCIA 3's Mark Maxwell talked to home care workers taking extra steps to stay safe while they travel from home to home.
And it conforms around your nose.
For caretakers like Gail Hamilton, getting dressed for work takes just a little bit longer these days.
And for us eyeball wearers.
The uniform of a home care worker has a few new parts, and the job a few new responsibilities.
In the COVID-19 era, we have to be even more vigilant with it.
I take care of disabled seniors and their residents.
Caretakers like Melissa Gary take extra precaution to make sure they don't become super spreaders.
You're trying not to spread something, but you don't know who touched something before you did when you get there, so you have to clean things up. I don't want to find out I'm carrying something into my house. I don't want the people I love to catch something, and I don't want to spread it to the people I care for.
They need the help, but they're as scared, if not more scared than we are. And a lot of them are, even though they need it, a lot of them are putting their services on hold because they're so scared.
Caretakers can often help seniors cook, clean, or deliver groceries. They also help workers with disabilities get ready for jobs of their own. But when Missy Norman lost hers, she told her assistant she'll have to manage on her own for now.
And my biggest concern was being a carrier, that I knew that my PA worked with other people that I thought would be possibly susceptible, and I didn't want to, accidentally make someone sick.
Now, weeks later, Norman is still waiting for Illinois to process her unemployment benefits, but she hopes that in staying home, she's helping to do her part to bend the curve.
By me making the temporary sacrifice, and I hope that everybody would make some sort of sacrifice, that ultimately we can go back to some semblance of normal sooner rather than later. The less people are willing to sacrifice now, the longer this is going to go on. And I'm just ready to get back to quote-unquote normal.
Reporting in Springfield, Mark Maxwell.
If you're an essential worker and get coronavirus while on the job, you can now get workers' compensation. This means workers won't have to prove anything in court. Representatives for frontline workers are praising this idea, saying it'll make sure those employees are taken care of. But some say it's not fair to employers. The employer can rebuke the claim if they can prove that person did not catch coronavirus while working. New for you tonight, millions of dollars in emergency aid money will be given to college students impacted by COVID-19. The U.S. Department of Education will be giving $218 million to colleges across Illinois. That money will be used for cash grants to students for expenses related to disruptions in their education during this pandemic. Those disruptions include course material, food, housing, health care, and child care. Each school will decide which students will get the cash grants. We contacted the U of I to find out how much it received and how it plans to distribute that money. But since this is so new, they did not have those answers yet. Items like fruit and vegetables go fast in grocery stores, how some are trying to cut out the middleman. Plus, COVID-19 has hit people health-wise, and it could soon cause problems for wildlife in a different way. day. And later, many sports are hard to practice if you're alone. What one Illini team is working on even though they can't meet.